Dr. Kevin Moser received his BA, summa cum laude, with distinction in biochemistry from the University of Pennsylvania, and his MD from the University of Pennsylvania School of Medicine, our nation's first and still finest medical school. In 1979, he came to York Hospital as a family practice resident. I have known Kevin since he was a resident and served on my service. From 1982 to 1990, he was a partner at Dallastown Family Practice and returned to York Hospital in 1990 as Associate Director of the Family Practice Residency. From 1995 to 2003, Kevin was the Medical Director of the WellSpan Medical Group, during which time it grew from less than 30 physicians to 150 providers with 500 employees and more than 50 sites. During those years, he was my boss. And I never signed a written contract. Kevin and I met annually, agreed on a base salary and incentives, and simply shook hands. In 2004, he was named Senior Vice President of WellSpan Health and President of Gettysburg Hospital. In 2010, Executive Vice President and COO of WellSpan Health, and in 2013, its President and CEO. Kevin and Carolyn have been married for 37 years, and they have 2 sons, Jonathan, a pediatric infectious disease fellow in Seattle, and Ryan, also in Seattle, where he leads a nonprofit identifying and assisting low-income inner-city youth with academic potential. Kevin was a Rotarian while in Gettysburg, and I'm delighted to welcome back to the Rotary Club of York the first physician to serve as President and CEO of WellSpan Health, Kevin Moser. Kevin.
Thanks, Ben, for that introduction. Occurred to me during it that I'm about to turn 65. I haven't yet accomplished as much as our 2 scholarship. Really kind of embarrassing. I would like to give you a little picture of WellSpan Health. Over the course, talk a little bit about healthcare, trying to set the stage, and then hopefully open it up to questions, because I'm sure there are lots of questions in the audience. I am extraordinarily proud to lead this organization. Obviously, my entire life is just about spent in some iteration of WellSpan Health. I'm particularly proud of the fact that we have had tremendous growth as an organization while remaining a York-based company, and so far have been able to maintain what is now the only community-based, community-governed by South Central Pennsylvania folks in South Central Pennsylvania, not owned outside of the community. So it's something that we're very proud of and dedicated to sustaining. So I'm just going to talk about a few things here. This might be what I think is one of the most important slides. I get a lot of questions about the specifics of healthcare, but one of the things that is incredibly important to understand is on this slide, and that is the growth in the number of people who are currently covered by a form of governmental insurance, be it Medicare, which is completely funded by the federal government, or Medicaid, which is a complex and collaborative funding by your state government and the federal government with contributions from the federal government. And you can see that in a very short period of time, the last 10 years, we've had rather explosive growth in both of those programs. I have that on. I'm afraid to touch anything. But the top line and bottom lines, though, have 2 different etiologies. The bottom line is Medicare, and you can see that that growth has really started to take off about 2010 or so. That's a simple demographic. There is an unprecedented number of people coming into Medicare as the baby boomer generation comes in, and we've only seen the start of it because the peak of the baby boom generation right now is about 63 to 64, so we're still going to see a peak coming in. And on the other side of the equation, I don't like to bring up sensitive subjects, but it's not like you exit Medicare voluntarily. And with lifespans increasing and health increasing over time, what you see is the Medicare also growing because you have fewer and fewer, we have people living longer and longer on Medicare. The top line, which is more dramatic, is Medicaid. And that is largely due to the impact of the Affordable Care Act and the expansion of Medicaid to our population, which has been a good thing in terms of promoting coverage without question. But here's the upshot of it that I think is something we all need to be aware of, and that is that on the right you see the rate of growth, average rate of growth in the last 10 years of federal revenue, grown about 3.3% in that time. Medicare costs have grown by 5.2%, and Medicaid costs have grown by 6.1%. And that's a very, because we're not talking about 6.1% of $10. I have to throw some numbers out because both my accountant and my financial advisor are in the audience questioning me about the honorarium for this. Tremendous stress on our ability as a society to afford the cost of the growth in coverage that we've undertaken in healthcare. That's not a policy statement, it's just a simple, bare financial fact. One of the things I should mention that you may, hopefully you're aware of, is that Pennsylvania has now been in Medicaid expansion long enough that the cost is beginning to shift over back to the state. And we'll be looking next year, for example, at 10% of that added cost will now be borne by the state, and is one of the fastest growing segments of our state budget as well. So all of this has forced tremendous revenue pressure onto healthcare systems. It has forced a lot of redesign of the way care comes. And so our business model has been shifting from the classic fee-for-service, like you provide a service, you get a certain pay, to being paid for the value of the service, both cost and quality together. And I think this has been a pretty good shift that I could talk about for hours, but suffice it to say that healthcare organizations all around the country, including WellSpan, are dealing with a very different business model and a transition into that business model that is a very complex transition for organizations to undertake. And part of the reason why you see a growing amalgamation of insurance and provider, which could be good or bad depending upon how you look at various levels of motivation. A lot of this cost pressure and time pressure and complexity that healthcare has added, plus the amazing growth of technology, has caused more physicians to seek employment, and so the growth of physicians who are employed by health systems has gone up significantly. The shortages, relative shortages of clinicians, be it physicians, nurses, nurse practitioners, has really heated up, and the cost explosion has been extraordinarily high. So last year was the first year that the expense growth for healthcare exceeded the revenue growth for healthcare. And that is expected to continue also this year, and that's because the pressure on wages within healthcare is extraordinary because of shortages and because of competition for talent, while at the same time, particularly Medicare reimbursement decreases about 2% per year. And therefore, health systems all over the country are struggling with this historic rapid expense growth with historic rapid revenue decline. The other thing is that, this is really no surprise, but we are not, this is a revelation, this is my take-home message, we are not the most consumer-friendly industry in the world. I'm sure you didn't know that. Complicated, we're difficult to navigate, and we have been slow to adopt the type of convenience and ease of use that other service industries have accomplished. And there's a wide variety of reasons for that, but people who use us, our patients and their families, as we put it, our friends and our neighbors, have come to expect a different level of access And so if an airline behaved the way we behave, which is you have to call a number and wait to talk to a human and beg for an appointment within, beg for a flight within 5 weeks at the airline's convenience, we wouldn't use that airline. And I believe there's a growing demand on the part of people who use us for us to be easy to use. We are, believe it or not, we are much easier to use than we used to be, and we are so far from our goal. It's a point of urgency for us. And then, again, no surprise, but affiliations, mergers, and partnerships are occurring at a rapid pace. I've been CEO of WellSpan for 5 years, and the landscape change has been phenomenal and unbelievable. And so our market has become much messier than it ever was. It has transformed almost overnight from a collection of locally controlled health systems serving a fairly defined and discrete community market to much larger players competing across all those historic boundaries, and many of them controlled outside of the market. So you have Penn Medicine, a Philadelphia-based organization, owning Lancaster General, probably the last health system I ever thought would be acquired. You have UPMC out of Pittsburgh, buying 5 hospitals within the market simultaneously, and then of course you have the growth of WellSpan, WellSpan Health in the market, and so and Penn State Health as well, being owned now partially by Highmark, the insurance company based in Pittsburgh. So very, very dramatic and rapid change in the market landscape, and one that fortunately we have been able to grow by collaboration with local systems in order to maintain that local presence. And we have really grown. In my 5 years as CEO, we have acquired and added now 4 organizations into our organization. And those of you who have done this in the world of business know that that is no mean feat, that integration and acquisition and merger is a complex business. But if you just look at us now, this does not include Summit Health, our soon-to-be partner. You can see that we have expanded our footprint to over 2 additional counties. We've doubled our system budget. WellSpan, with the addition of Summit, will be a $2.7 billion York-based organization. Our admissions have almost doubled. Just about everything in our organization has doubled over a very, very short period of time. And we are, another little known fact, we are the largest health system provider of health care in South Central Pennsylvania. A lot of people don't realize that WellSpan is a larger organization than, say, Penn State Health. And we're significantly larger than Pinnacle Health, UPMC Pinnacle rather, and we'll be solidifying that position. Now, we're not the largest organization that provides services in South Central Pennsylvania. I'm not even quite sure who that would be because the numbers change almost daily. But for who provides the actual care in South Central Pennsylvania, that provision, we are the largest organization. Our model is what we call local systems of care. So we are passionately dedicated to improving local access to services and keeping people as close to home as possible. We have a foundational organizational belief that when you get your care as close to home as possible, where your support system is and your family is, that your outcomes are bound to be better, and that your care is going to be more comfortable and better emotionally supported. And so rather than what is kind of classic model in healthcare of what's called hub and spoke, where you acquire other organizations to feed your main hospital that has capacity, another shocking fact, we don't have any capacity at York Hospital. We're full to the gills all the time. And what we do rather is take that local system that we acquire and we build services in that system. So in Ephrata, we have added interventional cardiology, we have added vascular surgery, we have grown their operating theaters, we've installed a new joint program and grown that system that way. Even in Gettysburg, statistically we know that compared to 1999 when we acquired Gettysburg, less people come to York for health care than did prior to when we actually acquired that system. This is very, very unusual and not very well tested. Most is like the strategy, for example, that UPMC has in the market, which is you build most of your advanced services in Harrisburg, and then you utilize your satellite hospitals to feed the investment that you make in Harrisburg by sending people from your variety satellite hospitals to that hospital. What do we look like in York County? Well, we now have 63 sites of care. I'm not even sure if that includes our new downtown laboratory annex, shameless promotion. We offer 24 primary care practices. Each of those are pretty sizable. We operate 2 hospitals, our WellSpan York Hospital and our WellSpan Surgery and Rehabilitation Hospital. We have a pretty strong ambulatory care network, and we have a growing behavioral health network thanks to our recent affiliation with Philhaven. We are now pretty well settled on the technical aspects of that merger so that we can start redesigning behavioral health care throughout our core market. And we have a very large home care agency which stretches across the entire region. We also provide extraordinary specialty care, and I'm taking pains to mention this because we are going to see an awful lot of hullabaloo about advanced care. Everybody wants to claim advanced care. But here in this market, we provide an extraordinary level, I believe, for a community our size of advanced care. We are a level 1 trauma center, so this is healthcare at its finest. The most advanced level of trauma is level 1, and the most advanced level of neonatal care is 3. So we just don't use any standardized terminology to keep you all on your toes. But we are a level 1 trauma center, and level 1 trauma centers are the highest level of capability. So other level 1 trauma centers are typically at university centers in the cities. And we have the largest NICU in the region as well, the neonatal intensive care unit. Only 3% of hospitals nationwide are comprehensive stroke centers, and York Hospital is one of them, with our very fine and very aggressive stroke care program. We also provide a high level of cardiovascular care, and in fact you may have read that Bill Nicholson, one of our interventional cardiologists, has twice now done demonstrations at York Hospital on advanced interventional cardiology procedures to the entire world, videocast across the entire world, internationally recognized. We have our cancer centers, and I'll be updating you a little bit on cancer care. And then our surgery and rehabilitation hospital, one of the reasons we built that is because our trauma program has grown so much. We have an awful lot of head injuries, and there is really no accredited brain injury program anywhere around this area, and so we're one of 9 accredited brain injury programs in Pennsylvania, and that hospital is a shining star in our organization, which we're very proud of. We have a luxury at WellSpan that I kind of like, and that's that we're not affiliated with any one academic medical center, and there is no one academic medical center that does everything better, the best in the world, even though they all claim it. So we have the luxury of doing selective partnerships that we think bring the most value to our community. And so we have 3 with Hopkins. Our cancer centers are now fully affiliated and aligned with the Sidney Kimmel Cancer Center in Baltimore. That allows us to rapidly get a case that needs that level of care there. It enables us to work with them on their precision medicine program, which I think is the finest in the world, and gets them to take a look at the cancer care we're providing and help us always provide a higher level of care. We've added pediatric general surgery to our York Hospital. We keep about 50 infants a year now at the hospital, thanks to our partnership with Hopkins that used to leave the community to get newborn surgical care. And we've been able to elevate our plastic surgery, particularly in the area of breast cancer and reconstructive surgery, through a very innovative partnership with Hopkins, where we employ a physician, but they're part of the Hopkins cancer and plastic surgery team, and they get stay up to date and be part of that clinical department. Then we have 2 partnerships with the University of Maryland. They have a proton treatment center that I will not even try to explain that, but it's an extraordinarily expensive and fairly new cancer treatment. And in order to make that available to our community, we worked an arrangement with the treatment center in Maryland. So our radiation oncologists are trained and credentialed to do the procedures there. So if you need that technology and you're under the care of a WellSpan radiation oncologist, they will go to Maryland with you and provide that state-of-the-art cancer care. We also now do a very sophisticated cardiac program called LVAD with Maryland as well, which has worked really well. So what are we up to? We open our new practice in Spring Grove in this October. We're really excited about that. It's right on 116. And we're expanding our Roosevelt Avenue practice. For old-time Yorkers, I always explain that as the building we put up where Damon's used to be. I have done many controversial things in my career, but I've never taken as much heat as I did when we tore down Damon's. Oncology, I'm proud to let you know that we are planning and preparing to execute a very, very significant expansion of the York Cancer Center, located on the Apple Hill campus, over 60,000 square feet, which will allow us to redo our model of care to be more synthesized and faster and much, much easier to use. And we're leveraging our affiliation with Hopkins to be sure that we are designing that to support what the future of cancer care is going forward. And I won't mention the capital campaign we'll be doing for that unless you force me to. Other things, we are preparing and starting work on a 10,000 square foot medical office building that is on Roosevelt Avenue, is near an unnamed, or actually right across the street from an unnamed small hospital. And we will be putting our cardiology services, specialized orthopedic care, and a lot of our neurology. Our neurology, you know, many systems don't do a lot of neurology, and we are actually a regional neurology provider, and we've outgrown an entire building on St. Charles Way. We thought we could bring that service then to the north end of town. We have recruited, last year we recruited 234 physicians and advanced practice clinicians, nurse practitioners, and PAs to our system. And we've recruited them from all over the country because our medical group is considered to be a very attractive place to work. In the last 2 years, we've recruited almost 450 providers to our market to provide care for the community. And if any of you use our services, you may have noticed that we have a new information system. We call this Project One, because for us it was a unifying, integrating aspect to our care by putting all of our care on a single platform. In order so people didn't have to register 3 times, so that you could get one unified bill, and so that our clinicians had visibility of all of your care at any one time. And in fact, our new platform, Epic, allows our clinicians to see what happened with your care at any Epic hospital, which would include Johns Hopkins, Lancaster General, Reading, pretty much everything except Hershey is kind of a holdout and not on that system. Our board invested $200 million in this system and its installation. It's incredibly disruptive to change a healthcare organization information system, just like you and yours. But we are completely converted and running as smoothly as possible, and getting great recognition from Epic for that. We think the technology platform we have now will allow us to do amazing things. We're very dedicated to becoming easier and faster to use and more convenient, and you'll see this theme over and over again. We have restructured and reinvested in urgent care, and you're going to see a large number of urgent care opening. We have one opening in the next month or so in Hanover, and then shortly after that we'll be opening our new one in West York over by the West Manchester Town Center. And we standardized our hours, we standardized our care, we lowered our costs and our charges. So we're very proud of our urgent care, and it's going to grow very, very fast. But we also are doing online urgent care. So when we're doing something for the first time, we experiment on ourselves. So our employees have been using these e-visits for almost a year and loving it. And we've done now partnerships with certain businesses in the community to try to make it easier and not have their employees necessarily have to leave work in order to get care. And we'll be rolling this out this fall to the general public. The advantage being that you can do that e-visit and the documentation is in your record, and when you go for follow-up to your own primary care physician or to the specialist, all of that information is right there in front of them. We also are committed to Hanover, and we view Hanover as being part of our community, and we feel very strongly that we want to offer our neighbors in Hanover the ability to keep their care in York County if they wish and not have to leave the market in order to get health care. So we are investing in an almost $50 million ambulatory center called the WellSpan Health and Surgery Center, designed specifically to confuse you with the WellSpan Surgery and Rehabilitation Hospital. That will have an ambulatory surgery suite. We'll be expanding our physician, particularly our specialty presence in there, and that will be opening in March of 2019. I talked about our urgent care and urgent care, and then we are expanding our urgent care orthopedics capacity in our orthopedic practice in Hanover as well. So I want to talk briefly about Summit and then take questions. We've had a very long-standing relationship. For those of you who have familiarity with Summit, it's an outstanding healthcare organization. It's about a quarter the current size of WellSpan. We have worked together on a number of services, and we've provided them a lot of support in the growth of their specialty services in their community, and we've had a very positive relationship. They were founded in 1995 when Chambersburg and Waynesboro came together. They're about $552 million with 3,500 employees. So if you're curious, at the end of the merger, we will have about 19,500 employees at WellSpan. They have 300 beds with Chambersburg and Waynesboro and a very extensive medical group, and are one of 5 organizations in Pennsylvania that have a AA bond rating. The others being the University of Pennsylvania, Geisinger, Mainline Health in Philadelphia, and WellSpan Health. So 2 of the 5 financially strongest organizations will be coming together in this merger. This is what our footprint looks like with the addition of Summit. It's very nice for us in terms of consolidating services across South Central Pennsylvania. And we're so excited about it. Where are we? We have everything in the Attorney General. We are through the FTC process. We are hoping, and told by the Attorney General's office, they should have a final agreement on us by September, and we hope to close our merger at the end of September and get moving. So with that, I hope I got through it fast enough to take a few questions. Bill.
Yeah, Kevin, given the realities of the external forces facing the healthcare industry that you mentioned today, when you look 5 to 10 years ahead, what do you see as the strategic opportunities for WellSpan? What do you think WellSpan would look like 5 to 10 years from now?
Yeah, actually, to be honest, I think in 5 to 10 years, we're not going to look all that different. I think our footprint is pretty well established. I think pretty much everything that was going to be for sale has been for sale, and we will continue to enhance our partnerships. So, my philosophy is that mergers are messy and time-consuming, and they're relatively easy. The historic mergers of smaller organizations being acquired by larger, but the activity today is more increasingly what are called partner transactions, which are same-size health systems coming together. So, for example, we merged with Lehigh Valley, which we have no plans of, so please no rumors. But they're about our size, up in Allentown. That would be a partner transaction. Those are very, very complicated. People are attempting them more and more, but they are pretty messy. And I think that distracts you from taking care of your community. But we have, for example, we are in a partnership called Allspire with Tower Health, Lehigh Valley, Atlantic Health System in Morristown, Hackensack Meridian. Together, we're a $16 billion organization. We have our own group purchasing organization. We have our own pharmacy benefit management program, and that alliance has saved WellSpan about $5 to $6 million a year just in our purchasing costs going forward. So we are an organization that would prefer to have you'll be reading about more and more partnerships. But our board, and this is not me talking because I'm just representing the board, our board is pretty dedicated to giving it a real shot to maintain this York-based, governed, strong health system with that has a sole focus on our communities here in South Central Pennsylvania. Yes, sir.
You talk about the rising cost of healthcare and lower revenue, and watching the number of people that are going on Medicare and Medicaid as that population grows. What portion of the cost of care is covered by Medicare and Medicaid now compared to where you see it been in the next couple of years?
Well, I can tell you that I can only give you statistics for our system because we're not allowed to share those things as competitor organizations, but we're well over half of our business right now is directly with the federal government. And it's one of the things that makes healthcare a little funnier business than other businesses because we're a price taker there. I mean, you don't negotiate with Medicare or Medicaid. You just take whatever price they determine to give you. I think that that there is a long-term attempt, and it has to be done. So, cost of healthcare is not the same as price of healthcare. They're not the same. In most businesses, utilization doesn't matter. So if I'm selling, I don't know, plastic components to something, it's a good thing if I sell 1 billion of them as opposed to selling 100 of them. But in healthcare, it's not really so good if you have an MRI machine to do 1 billion MRIs when you could do 100. So cost is really utilization and price. And so the trick in terms of lowering healthcare is going to be short term. We're going to keep hammering at price. Long term, we have to figure out a way to reduce unnecessary utilization of services and then make sure that people get services they need and only the services they need. And that's one of the reasons why the risk for the cost of care is being shifted more into the provider space, so that providers have some skin in the game as to how much the overall cost of healthcare is. It de-emphasizes price, and it increases your ability to manage a population of people at a given price, so at a given cost. So I think that is really going to kind of be the secret. From a national level, if you just want my opinion, and because I'm really close to retiring, I can get away with anything. You know, the interesting data that is emerging is everybody shows the cost of health care, say, in other countries, and compares it to the cost of health care in the United States. And the United States, of course, is higher than other countries. If you take spending on social determinants, they even. And so the difference is not so much what we spend on health care. The difference in between us and other countries is that we're taking the same bucket of dollars and distributing more of it into health care than we are into what we call social determinants of disease. If we can do anything we want as a healthcare system, if everybody starts smoking, we got a big problem on our hands. Violence. Look at our hospital, you know, we've had 2-3 homicides a day over in certain days in the months. Not every day, but we've had as many as 2-3 a day. That's so expensive, you know, to do that. So I think the challenge for us as a society is making the choice between how we address the social determinants of disease and how much we invest in trying to correct social determinants of disease. And it's not a political statement, it's just, again, raw numbers. And how much we're going to invest in healthcare, but how we make that transition without destroying the healthcare system. I think that's the challenge it's going to be.